that we will be recording, and not the question and answer section at the end. So just wanted to alert you to the fact that it is being recorded, and it will be posted on our website for others who weren't able to make it and sent out to those who request it. So UBC Okanagan we're proud to be part of UBCO, and we have the Okanagan campus located in Kelowna, British Columbia. And we have a number of credit programs. We have a large Bachelor of Science in Nursing program. We admit about 200 students each year. We have a post-baccalaureate certificate now in primary healthcare that is running for the first time this in the next month. It starts in February. And we have a Master's of Science in Nursing as well, which usually has around 26 to 30 students. And we have a PhD program in nursing. And we do have some hopes and dreams to have a doctorate in nursing practice starting in the near future. We're just in the works of developing that. So we're quite proud of our programs. Today, nursing primary care and education is important to both of us. Nellie and I have been leading, and we will be the co-presenters today, been leading the development of primary nursing education programs at UBCO. So I'll introduce myself, and then I'll let Nellie introduce herself. So my background, I have been with the school for many years with the university. I've played a significant role in curriculum development provincially, and locally, I led the BSN review and revisions at UBCO back in 2014. And I have been involved in the primary care nursing piece. My background at UBCO, aside from that, I've been in leadership, and I'm a teacher in the School of Nursing, and I've taught in all 4 years of the BSN program. So now I'll pass it to Nellie.
Hi, everyone. Welcome. I'm Nellie Oakey, and it actually says professor there, but I'm an associate professor. I am one of the research faculty that work with the School of Nursing. And my area of research is, or areas of research, definitely is around primary care, primary health care, looking at primary care interprofessional teams, and do also a lot of work in rural nursing, as well as I work with the Rural Coordination Center of BC, as well as a scientific director. Back to you, Sheila.
Thank you, Nellie. So today we'd like to share with you a little bit about the situation of primary care in Canada, a bit about primary care nursing, that we're talking about. So what is a primary care nurse? And then we'll tell you about our program and give you an overview, and then we'll open it for some questions and discussion. So primary care should be the first point of access for people to access a primary care provider, like a family physician. Ideally, we would be working in interdisciplinary team-based care is ideal. Generally delivered, primary care is generally delivered by family doctors or nurse practitioners, and is focused on the overall well-being of clients through their lifespan. So ideally, it should be a longitudinal care where people are receiving care throughout their lifespan, and their conditions are being monitored and supported throughout time. And ideally, a registered nurse, should be part of this team-based care, this integrated team-based care. And research has shown that it's ideal. So I'm going to pass it back to Nellie to tell you a little bit about primary care in Canada.
On this slide, Sheila? Yes?
Yes.
Okay, great. So I just want to highlight that primary care is the foundation of a very successful or effective health system. In Canada, we definitely have a fair bit of work to do in that area. When you look at the report looking at primary care and outcomes for different countries, Canada rates in 11th in that rating, so quite a bit lower than a lot of other countries. And in fact, United States is the only one that is below that. And we understand that that is the situation as they have a private system. So we know that if we have a strong primary care system, that then the outcomes are better. And so, we say and we talk about at least 50% of care should be provided in the community, and that would be largely through primary care, and that it is best provided by an interprofessional team. Um, and that is one of the ways that we can address some of the health human resource shortages that then is a struggle that we struggle with here in Canada, and also is a struggle across the world. So many Canadians struggle to find a regular healthcare provider. There is approximately 30% of Canadians that do not have a primary care provider. And 5.4 million, so 17% of Canadians aged 18 and older, said they do not have access to regular health care provider. The problem is that if people don't have access, and access can be very variable as well. You might be attached, but you're still having struggles getting in because they don't have capacity, or you simply don't have the option and you only go to urgent care or emergency, and or you simply don't get care at all. And then you end up in these situations where people are much sicker than if we could have dealt with it earlier. So putting patients at the center of healthcare delivery is definitely our goal. It's the goal of provinces, and the provinces in Canada are definitely committed to strengthening team-based primary care. And that works under a number of different models. In BC and Alberta, we have primary care networks. They do differ. And in Ontario, they have family health teams as well. So there are different models across Canada. But essentially, what a primary care nurse is doing is very similar.
Thank you, Nellie. So I think from that, we take that primary care providers develop that relationship with clients and are able to offer a range of care, including education, promoting healthy lifestyle choices, managing their chronic disease condition, diagnosis and treating newer illnesses and injuries as well. So the idea is that longitudinal care. And registered nurses are generally a part of the team. And there are many things that the registered nurse in the team can do. They can do assessments, illness care, health promotion, disease prevention, rehab care, supportive care, administrative responsibilities. They can be involved in research and quality improvement. And I think as nurses, we understand that your competencies can build. So, sometimes we may have skills in, say, health assessments, but to work to full scope in primary care, your health assessment abilities need to be strengthened for the area that you're practicing in. And so nurses working to full scope is the goal in primary care. And so when we undertook this work, we realized that primary care role doesn't really require a graduate degree. However, it does require additional competencies from the undergraduate nursing programs. And so the national competencies for nurses in primary care developed by the Canadian Family Practice Nursing Association underpins our curriculum. And we mapped the entry-level competencies of a new graduate to these national competencies for primary care and identified the gaps. And a lot of the gaps were not that the undergraduate students didn't touch on the concepts, but a lot of the concepts were literally just introduced in the undergraduate program. And in primary care, we need nurses to have fuller scope and have the competencies at a more broad and robust level. So the environmental scan that we undertook revealed that there really was lacking in terms of post baccalaureate nursing education for nurses working in primary care. So there's a number of nurses who have moved out of acute care or out of community care into primary care and don't have the ability yet to work to full scope. Even though they are able to work to a fuller scope, a lot of them are lacking the experiences or the competencies that are required in their workplace. And some nurses don't want to take a graduate degree at this point, and some nurses are looking for more practical skills. So we thought we could fill this gap. There is a number of, online independent modules available to students if they're interested. A lot of them are chronic disease focused, and students can independently take some free online modules to enhance their knowledge, mainly of chronic illness. And so I would point you to the Alberta Health if you're looking for some modules on those kind of topics. Primary care and nursing is not the focus of most undergraduate programs. Community health is, but it's a very large umbrella, and primary healthcare may be mentioned within the undergraduate curriculum, but students are usually not given a large amount of content around primary healthcare, and often are not given any practical experiences in primary healthcare. And the only post-basic education that was available, that there was one originally in Ontario that has since been closed. Nova Scotia has a program, but it's only available to nurses practicing in that program. It's an expensive program that's supported by the province and by the practicing physicians who have these nurses. And so it isn't open to outside of the province. And the Canadian Family Practice Nursing Association now does have online modules. So if you join their association, $20 membership, you can have access to the 6 new modules that they've created. And they have a community of practice as well. And I would say that the content that is in those 6 modules is clearly covered in our first course, in our certificate, and we go deeper. And our second course is definitely beyond what would be available in those modules. So again, choices for nurses are beginning to show up. So our goal is to provide registered nurses and registered psychiatric nurses with the additional competencies, and even just the building of their competencies, to prepare them to work in an integrated team-based primary healthcare context. And we recognize that nurses are working in primary care in different settings. And so, it's not like one size necessarily fits all, because it might depend on where nurses are working and what skills mix they need. But underlying all nurses, there are some foundational pieces that all nurses working in primary care should have. And I think that we've captured that in this certificate program. And so nurses are working in primary care networks, are working in patient medical homes, family practices, urgent and primary care centers, community health centers, First Nations primary health care centers, nurse practitioner run primary care, foundry centers. So there's a number of opportunities for primary care, and I believe they're expanding in our province again. I believe I'm under the impression there's a number of new positions opening in the province in the next month or so. And the BC, if you go to the BC government website, they are promoting nurses in practice in primary care. And we are working, as Nellie said, we have a ways to go. But, I think the energy is there in the political mindset at the moment to move us forward. So this is an overview of the certificate program. It consists of 3 separate courses. The first 2 courses are theory-based courses. So more of a traditional classroom type course, even though it's offered online. And the final course is a preceptorship, so a practicum in a primary care setting. And so total, it's a 10 credit program offered over a year. So students coming in can take the courses at either the 400 or the 500 level. We are going to be moving to having all students who initially register in the 400 level. And then students, if they'd like to take the 500 level, can communicate with us and request that. We would change their registration to a 500 level. Now, some students might want the 500 level if they're considering graduate education, but really the onus is on the student, on you, to look to see what graduate programs you're interested in taking and what their criteria are. Some programs allow you to transfer credits in. Some allow you to transfer credits in at the 400 level, and some would be at the 500 level. A lot of them have limits of 3 to 6 credits on which they allow you to transfer in. UBCO at the moment allows you to transfer in 6 credits at either 400 or 500 level into our MSN program. Some of the students I've talked to who have been away from formal studies for a number of years, I have suggested that maybe they consider taking the first course at the 400 level, dip their toe in and build their skills in the academic arena again. And then once you feel more confident with writing papers and some of the academic components, then to maybe consider taking the next course at the 500 level. And that is a possibility. And the main difference between the 400 and 500 level is the assignments. So when you're taking it at the 500 level, which is the graduate level, the 400 level is an undergraduate level, we require a little bit more robustness in the work and the assignments that are done. So usually more readings, more references in papers, and if there's a discussion board or those kind of assignments, often the students are charged to, asked to do some leadership in those, or a little higher level of analysis and application of the material that they're handling in the program. So that kind of gives you, and if you have any questions about, should I take it at the 400, should I take it at the 500 level? I'm always open to have a conversation with you one-on-one. You can email me and we will make sure you have my email, and we can arrange to meet on Zoom or have a telephone conversation if that would be helpful to you. So here's an overview of the scheduling for the program. Nursing 425 and 525 is actually in February of 2025. The registration is now open. And so that's the first 3 credit course, Primary Care Nursing 1. And then Primary Care Nursing 2 will run in September of 2025. And Nursing 435 and 535, which is the preceptorship, the practicum component, can run in any 3 terms. So if you wanted to complete this program within a calendar year, you could do so. But if you didn't want to, you can flex. And you can have some room with that. Just recognizing that each of these courses, the first 2, the Primary Care Nursing 1 and Primary Nursing Care 2, are only offered once a year. So the one in January and one in September. And so before you go into the preceptorship, you must have completed both courses. So once you've completed both Primary Care 1 and Primary Care Nursing 2, you can take your preceptorship kind of when it works for you in terms of your work schedule. You need to it's 120 hours. So doing it full time would be like a month, in the time, but this can be spread over about a 3-month time frame, so that you might be able to work it in with your work schedule and take a few days off a week and maybe do your preceptorship over 2 or 3 days a week versus 5. So there is some flexibility in how you do your preceptorship. And we would have individual conversations with students on arranging that between you and the site that you're going to and the preceptor that's taking you. We don't want it to be too diluted, because we want you to be consolidating your skills and being in the practice setting. So we don't want it to go beyond the 3-month time frame.
Sheila, I just wonder, I'm just going to interrupt for a minute, if it's helpful to also talk about where they can take their preceptorship.
Sure. Your preceptorship can be arranged anywhere in Canada. We have agreements, practice agreements, we call them affiliation agreements, with every health authority in BC, with most health authorities in Alberta, and we have a number of other affiliation agreements with different practice sites. So if your practice site is one of those, it's going to be a really easy for you to have your preceptorship in those locations. If it's a one that we don't have a current affiliation agreement, we need some lead time, usually 3 to 6 months. So what we would be encouraging students to do is to communicate with our practice placement coordinator early, and we would then arrange that. But we will help arrange practicums all throughout Canada. And if you're already working in a primary healthcare setting, that might be the ideal location for you to do your preceptorship. And we're okay with that if your site is okay with that, and there is a preceptor for you. And that might work because then you can work on the particular skills, kind of like an intentional learning. So you can really build those skills that you're looking to build. Versus if you are not working in primary care and you're going into a primary care setting, it would be ideal to just shadow the nurse and really work with what the nurse is doing in the role that you're working in. So those are conversations that we can have, but absolutely they can be arranged in your community of practice. The other option, if students are interested in it, we could arrange for a practicum close to Kelowna, and we can arrange for housing if you were choosing the summer term. We can arrange for housing on campus for you, and that would be an opportunity to maybe spend some time in Kelowna and do a primary care clinic in this area if that is something that was of interest to you. So those are some options. I did include the tuition and student fees below. The tuition fees are $198.67 per credit. They typically do go up 2% a year. And there's usually some student fees attached as well. They're not a large amount, but there's probably, I think, less than $100 of student fees as well. So just so you can plan accordingly. And of course, you can check the calendar for the details. The link is there. So what are the program requirements? We require that you have the English requirements to come into the program, and the link to the calendar is there. That's the standard UBCO requirements for English. And we ask that all applicants hold a current practicing registration in Canada. It can be in any province, but it has to be Canadian. And that is attached. The reason for that is because of the preceptorship that's attached. The practicum, we need you to be licensed, registered, and in good standing in the province that you're registered in and practicing it. So the learning outcomes for the program, so if you were to take the entire program, students will be able to use an equity lens. So that's where, thinking about equity and diversity and inclusion is essential in nursing practice. And so using an equity lens, students will gain knowledge of concepts and frameworks foundational to the role of primary care nursing that serves diverse populations, serves to reduce health disparities, and promotes equity. Learners will also learn to develop assessment approaches, care planning, and evaluation care for disease and health promotion across the lifespan, and explore interprofessional collaboration care delivery models. So there are, like Nellie said, there's a number of different care models. And so, in the courses, you'll be looking at those care models and, of course, the outcomes from the care models. Following the program, students will be able to use an equity lens to explore evidence-informed guidelines and care planning for providing quality care, build knowledge base of case management, care coordination, system navigating for lifespan and care across the continuum. And I can say from the literature, this is a role that nurses tend to really enjoy if they're in a primary care setting where they get to be involved in kind of that autonomous practice of case management and care coordination. It is a highlight for many nurses in their practice. Following this program, you will build knowledge of quality improvement principles and a way of supporting safe quality care. And I think you will develop knowledge, skills, and abilities in primary care nursing competencies in a primary care setting. Particularly, you'll learn the theory in the first two courses and learn a lot about primary care leadership and nursing practice. And then you'll have an opportunity for 120 hours in a practice setting to really build that knowledge, skills, and ability to consolidate. So a little bit more detail about the courses and the programming. So the programming is beginning this term for us. And so the first class is actually February 27th, and it's a synchronous session. So the dates are all there. So it's designed to run over 6 weeks. Designed that you will have as a student, you need to plan that you'll be online. So within a synchronous session for 3 hours every Thursday from 2 o'clock, from 1400 to 1700. So once a week, that 3-hour commitment of a synchronous learning session online with the instructor. And then the other 3 hours that week is an asynchronous learning modules that are online, and they're designed for Tuesdays. So those are the kind of the time commitments that are involved. And then, of course, I think in any academic course that you take, there's the assignments and the pre-reading. So the prep and the pre-reading that you need to do before you come to class. And then there's assignments, and I believe there's a paper in this course as well. So just recognizing that there is some workload outside of the classroom. For sure, for a 3-credit university course. And we anticipate that the scheduling will be similar in upcoming courses. So in the fall, when we run 425, we anticipate a similar schedule. And just to kind of give you a heads up too, in the 424, so in the first course, nursing primary care 1, there will be undergraduate students and some MSN students in that course. I think right now we have like 20 BSN students and a few graduate students already in that program. And I think potentially we have about 20 certificate students in that, joining that cohort. So it's going to be a fairly big, robust class, this first course. The second course, the nursing 425, we anticipate a smaller number because our undergraduate students do not take it. So it'll be kind of the cohort that you came to know that were in the certificate program only. So it'll be a smaller section size, to let you kind of know that. So 424 is primary care nursing 1. It's an introduction really to the kind of the foundational underpinnings of primary health care and primary care nursing. And so students will explore concepts and frameworks foundational to the role. They will consider, really, it'll have a focus on serving diverse populations, reducing health disparities, and promoting equity in care and access to care. It will have a look at what assessment approaches are used in primary care. It will look at different care planning models and evaluation of that care, building evidence-informed disease prevention models, and managing health conditions across the lifetime. So it'll be looking at the models and the approaches that are used in primary care. And one significant component is also considering what is good quality interprofessional team-based care and looking at some of the models around that. And then nursing 425 goes a bit deeper in exploring evidence-informed guidelines and looking at care planning and providing quality care and building knowledge of really that case management, care coordination across the lifespan. And so this would be a little bit more of an application course. So taking what you learned in the first course and applying it into more practice-based case scenarios so that you build your knowledge. And it will have additional pieces on improvement principles around supporting quality, safe care. And then 435 is the preceptorship. We do have what we call intentional learning work for primary health care. So if you're not familiar with the term intentional learning, students will have some learning activities that they can take with them into the clinical setting to focus on what they really need to learn, what competencies. So it's sort of like you can do a self-assessment and know what you really need to focus on, and we will have some of those tools available for students. So for example, if you've come out of acute care and you're new to primary health care and you really need to build your health assessment skills that are needed in the primary care setting, we would have a learning activity that you can use that would really help you focus on developing that particular skill. If you're new to primary care or you don't currently work in primary care and you're doing a preceptorship in there, we would probably give you these access to the intentional learnings, and you might use some of them depending on your context. And so, you might just do what you did maybe in your undergraduate program where you follow the nurse and do whatever the nurse is doing, and you'll learn as the opportunities arise. But there are some intentional learning activities where you could maybe one day say, well, I really want to focus on learning this particular skill. And the preceptor could arrange for you to maybe be in 3 health assessments that a day if that was your learning goal. So I think there's quite a bit of flexibility in your learning in the preceptorship model. I think we've covered this. This is your opportunity really to consolidate your skills and have that practice opportunity. Your preceptor can be a registered nurse, a nurse practitioner, or a physician. I think the nursing role would be ideal because one of the challenges in primary care is kind of that nurse role and understanding what the role is. And so it would be ideal if you were with a nurse practitioner or a registered nurse in primary care. But in some settings, it might not be a possibility. So we are open to having a physician be your preceptor as well.
And
And
Sheila, yeah, just to mention the 4 credit versus the 8 credit.
yeah, and so that might be confusing. So in the certificate program, you're required to take the 4 credit version. So the 120 hours. The 8 credit, 240, is for the undergraduate students. So we do have a learning pathway where some of the undergraduate students are working towards primary health care and they want to work in as a primary care nurse. And so they would require, because they're novice, the 240 hours. And in fact, we're working to have them do an additional 4 months as an ESN in the same setting. So the idea is that they need longer than a nurse with experience would require in this. So you would be taking the 4 credit version, which the cost would reflect that, and the time commitment would be 120 hours in the practice setting. So I think that brings my information part to a close, and then we'd just like to open it up for questions and any discussion. I am going to stop sharing so that the visibility improves a little bit.